So after you've had the baby and you've recovered from delivery, they're going to move you to a postpartum room. In most hospitals, it will be a different room than the room that you labored and delivered in. So you usually stay in the LDR, labor delivery recovery room, for about an hour or two after you deliver, and then you and the baby will be taken to another area of the hospital where you'll spend the rest of the time, and that's called your postpartum room. Most hospitals nowadays have private rooms for new mothers and newborn babies. Some hospitals still have what's called semi-private rooms, which basically means you have a roommate, and very few hospitals have wards where there's 6 or 8 or 12 people all in the same room. That's very rare. That's something that you want to talk again to your doctor about to find out what the situation is in the hospital that you're going to deliver, and it might be one of the things that helps you decide which hospital you want to deliver in. I think it's much more comfortable, obviously, if you have your own room. That way your husband can stay in the room with you. You're not kept up at night by the other person's crying baby, and that way you have your own room to stay in. Most hospitals nowadays have rooming in with the baby, which means that they've gone away from these nurseries where we put the babies in the nurseries like kind of you see on sitcoms where there's a nursery full of babies. Generally, the baby's going to stay with you the whole time you're in the hospital. If you need a break, the nurses can help you with that, but in general, the baby will stay with you the whole time. The room will look like a regular hospital room. There'll be a bed and a shower and a bath and a TV, and usually it's a little bit less fancy than the LDR rooms, but not all the time. And again, there hopefully will be a place for your husband to sleep as well in that room.